Have you ever heard of any condition called deep vein thrombosis before? Well, this condition is a very serious one, and someone may ask, what is deep vein thrombosis in the first place? Now, deep vein thrombosis is a health condition, okay, that is being caused by blood clot formation in the deep veins, typically in the legs. Okay, so we know the blood is supposed to be moving. Okay, this deep vein thrombosis is a condition that can set in when there is a blood clot formation, okay, in the deep veins, most typically in the legs of human beings. Hope it's clear now. Yes, this is just a basic description of what deep vein thrombosis is all about. Now, someone may ask, what are the possible causes? Okay, so basically there are some causes that you need to take notice of, and then they are as follows. First one has to do with immobility, that is especially prolonged bed rest. Okay, when you are not moving, when you lie in bed for long, most especially in our patients that are actually bedridden, they are at a high risk of getting this deep vein thrombosis. And then secondly, what you need to consider again as a cause is trauma or surgery can also cause this one. The third one has to do with cancer. Okay, the fourth one has to do with inherited blood clotting disorders. Okay, yeah, it can be passed on, kind of inherited one. And then the age, that is 65 years plus. Okay, we have obesity also. That is why you need to take your diet very serious, mind what you eat, and then the time in which you are eating, check your weight, be consistent with that. Okay, and then avoid smoking, which is another one. Smoking is another cause. Avoid smoking. Okay, yes, so let's get into some risk factors that can expose you to this serious health condition. So these are some of the risk factors. We have family history. Okay, when any of your family member has this condition, you are at a higher risk of having it also. And then we also have diabetes. Okay, when you are diabetic, you are at a higher risk of getting deep vein thrombosis. And then we have hypertension. Okay, that is basically high blood pressure, can also cause that. And then the next one has to do with when you have some heart diseases. Okay, you are at a higher risk of also having this condition. Now, someone may ask, what are the signs, the possible signs and symptoms to consider when you are having this condition? Or someone may ask, what are the possible signs and symptoms? Now, I have some gist for you. Let's get in. The signs and symptoms for deep vein thrombosis are as follows. Remember, take these very serious. Don't take them lightly. So the first one has to do with, so when there is swelling, redness, and then warmth, that is when there is increased temperature, the place becomes kind of warm in an affected area, specifically the legs or the limbs. Take note of that. And then secondly, when you have pain or tenderness. Okay. And then the third one has to do with weakness. When you're experiencing weakness, most especially in your legs. Okay, and then the next one has to do with visible veins. When you can see your veins, try as much as possible to visit the hospital for further treatment and then diagnosis to find out what exactly that is occurring. Okay, remember, these signs and symptoms, you need to take them very serious. Don't take them lightly. I repeat, don't take them lightly. Visit the hospital or tell a licensed healthcare professional for further examinations. Now, let's get into the role of physiotherapy. As I said, I am a student physiotherapist, and then anything physiotherapy, I'm in there. And then when I don't talk about anything physiotherapy, I don't think the video is going to end. So let's get into the video. So I'm going to give you some rules of physiotherapy in this condition, and then they are as follows. One, the first thing we are looking at as physiotherapists is prevention. Okay, this condition is preventable. You can prevent it. So we actually try as much as possible to prevent this condition by promoting mobility exercises. Okay, yes. And then we also bring in management. We manage. Okay, that is really helping reducing the swelling, the pain, and then also improve circulation. That is when the condition has set in. Okay, and then the last one has to do with rehabilitation. Okay, so we strengthen and then those muscles that are weak, and then we strengthen them. And then we also bring in range of motion exercises. I mean, exercises that can enable adequate movement within the various joints. Now this brings me to the end of the video. Don't forget to subscribe, like, comment and share, and stay in touch. See you guys next time. Bye.